Welcome to Coronavirus, What You Need to Know. This is our 9th live town hall program in the series. These programs are produced with input from public health agencies around the Bay Area and regional nonprofit organizations. And the entire program is based around answering your questions. Good evening, I'm Darren Lachelle, President and CEO of Northern California Public Media.
And I'm Adia White, Assistant News Director at Northern California Public Media and your co-host for tonight's show. There's a lot to talk about tonight. Today, we have 2 new testing sites in Sonoma County that are being launched with the state, and you don't have to be symptomatic to qualify for a test. Governor Gavin Newsom also announced this week that the state will gradually begin reopening some businesses starting on Friday. We'll talk about what this means for Sonoma County. And protesters statewide and in Sonoma County demonstrated against the shelter-in-place order over the weekend. We'll talk about what a gradual loosening of restrictions will look like and look into Sonoma County's shelter-in-place order. Sonoma County Health Officer Dr. Sundari Mase will also be joining us in just a minute, but first, Darren Lachelle will go over how to submit your questions for tonight's town hall. Darren?
These town hall programs give you the opportunity to ask public health officials, medical professionals, and our elected leaders the questions that are on your mind. You do that by visiting the easy-to-use contact form on our website, which is norcalpublicmedia.org/coronavirus. The contact form can be found on all of the pages and news articles that deal with COVID-19 updates and information. Adia, back to you.
We're now in the studio with Health Officer Dr. Sundari Mase, who will be giving the latest coronavirus update and answering some of your questions. Thank you so much for joining us.
Yeah, thank you for having me, Adia. So currently, worldwide, we have 3.5 million cases, and we've had about 251,000 deaths. Here in the U.S., we have about a third of those cases, about 1.2 million, and we've had close to 70,000 deaths. In California, we have about 56,000 cases and about 2,250 deaths. Here in Sonoma County, we have a total of 261 cases, and I want to note that we now added 11 more cases today. So that'll put us at 272 cases. And we had 1 additional death that we'd reported, and as I noted in my media press briefings, all 3 of the deaths in Sonoma County have occurred in people over age 65.
We've also learned some news about testing this week. We have 2 new testing sites in Sonoma County, although we're learning that it's difficult to get an appointment. What are those new sites looking like right now?
Yeah, so these are state-funded sites. There's a contractor, OptumServe, that's opened 2 sites. One is in Santa Rosa, the other is in Petaluma, and I think you have the phone number for making an appointment on your website. Anybody who wants to get tested for COVID-19 can call, make an appointment, and get tested. They are going to be able to test 130 persons each every day. So that's adding an additional 260 tests a day for Sonoma County.
Wow. Although we are learning that most of those appointments are booked up, it's really hard for people to get in and get a test. What about Sonoma County's testing? Yeah,
so we are also testing, and this is timely because we're expanding our priority list this evening, and in fact, those people now who are over age 65 and have any symptoms that could be consistent with COVID-19, or people of any age with underlying medical conditions like the lung diseases or pulmonary cardiac diseases, immunosuppression, those people can also call and make an appointment now. So we've already been testing healthcare workers, as you know, asymptomatic and symptomatic. First responders, also asymptomatic and symptomatic. And as of this evening, we're adding a 3rd priority group. So you can call and make an appointment.
That's huge news, because I know a lot of people out there are really wanting these tests. You know, this comes on the eve of learning that a lot of people were hopeful that they would be able to get a test through the state here in Sonoma County, but now we're learning that you can, in fact, go through Sonoma County's local testing sites now if you are symptomatic or over 65.
Well, if you're symptomatic and over 65, or if you're symptomatic and with any age with a medical condition. That's our next priority level. Now, we are filling all the testing appointments, and in fact, I think this week's appointments for OptumServe are booked. So next week, we're actually looking and have asked the state to add another lane at our sites to double the OptumServe testing capability to meet our needs.
And how soon could we learn whether or not that will go through?
I hope by next week. We've asked to open an additional 260 persons bringing that total to 520 persons that can be tested in a day.
And so Sonoma County sites are all drive-through, whereas the state sites, you actually have to walk into the facility. Can you explain what that looks like?
Well, I mean, ours are all drive-through where we test people as we've described, through their window. And OptumServe has its own criteria. I don't know exactly why they decided to test in that manner.
Okay. Have you heard that some people are nervous to actually go into a building?
Yeah, and I want to just tell people that everyone is protected. They're wearing their facial coverings, and the healthcare workers are wearing the PPE, and they're being very careful with cleaning surfaces. So shouldn't worry about going in to get tested.
All right. So we're going to jump into some listener questions here. The first question is about whether or not people should seek testing, right? So this person says they're 68, asymptomatic, and have been sheltering in place since March. And also they have underlying health conditions. Should I get testing now that it's available?
Well, I think that's a personal decision and choice. I'm really happy to say that we're able to offer testing for anybody and everybody. And if you feel like it would offer you peace of mind to know what your test result is, I would say absolutely take advantage of it. On the other hand, it wouldn't really change how you perceive COVID or what you would do differently, then I wouldn't get tested.
So now that we're learning that these testing sites through the state are filling up, would you recommend that people who, are asymptomatic and younger and healthier not reserve an appointment right now to leave that open for people who might need it more?
Again, I think it's better that we have a prioritization and that people who are symptomatic first get tested. And I want to assure everybody that through the Public Health Department, we will be testing all symptomatic persons in the community soon. And the way that we're marching through this, hopefully by next week even, we'll be able to offer testing for symptomatic persons in the community. So if you feel like you want to get tested through OptumServe, I think it's worth getting an appointment.
And I imagine that this data will be extremely helpful to your office as well.
I think so, because it'll give us an idea of if there are a lot of asymptomatic persons who test positive in our community. I suspect we're not going to find that many because, as you know, we really interrupted the transmission in the community early on.
So this person is wondering whether essential workers, for example, grocery workers who are on the front lines, and as of a couple of weeks ago, only recently had enough protection in stores, will they be tested eventually as nurses are now, and as we're learning other
Yeah, they're
folks?
part of the priority group. So as we move forward to the next categories, we will be offering testing for essential infrastructure workers who are symptomatic, and we'll expand that to people who work in grocery, all essential workers who are symptomatic, and then we'll go to asymptomatic individuals. That'll be our last priority.
So where do they land on the priority list? Are they immediately after folks who are older and symptomatic, or?
After older and symptomatic, yes, we go to the essential workers next.
And is there anyone else included in that group that people should know about?
Well, they're really all of our infrastructure workers, so people are working in utilities, in the court system, for example, other branches of government, that's who we'll be going to next.
All right. So the county website reports the number of tests, but it seems like these are only tests done by the county. Are the private hospitals reporting on the county website?
Yeah, in fact, when you take a look at the number of tests that we've given, it includes all the testing for Sonoma County. So that does include our hospitals and clinics.
So I know initially they were only reporting back on tests that came back as positive. Now they're reporting negative tests as well?
Yeah, we're getting all of the negative test results as well. They may come in a little bit with more of a delay than the positive test, but everything is going into the system.
All right. And we talked a little bit about antibody testing last week as well, but people still are really curious about when we might learn more about when this will be available and who will be able to qualify.
Yeah, so we're hopefully going to have that up and running. We're hoping in the next 2 weeks we can offer antibody testing. And again, let me just make it really clear that that's not for diagnosing COVID infection. It's more for telling who's been infected and has the antibodies to COVID. So we might start, say, for example, with our first responders, because we had cases in that group, to see if many more of them had actually been infected than we know. That would be a good surveillance. We are also going to just do a representative sampling of our community to see what percentage of people actually got infected with COVID in the last 3 months, just like Santa Clara had been able to do last month.
Right, so it might be individually only useful, more or less for curiosity's sake, but for the county, that data is very valuable.
Yeah, exactly. So this is mainly for surveillance and for us to determine what percentage of the population actually got infected.
Right, because again, we don't know whether or not, if you had been infected, we still don't know whether you could be infected again. So it doesn't really define or help you make those decisions.
Yeah,
personally.
it's not a diagnostic tool.
Yeah. And then can you elaborate, how many machines will we be getting in?
I think it's just one machine that can run something like 120 tests at a time, but I'll have to defer to our laboratory director. And in fact, what we'll do is we'll put out some information through the Facebook live stream specifically on the antibody testing as we get closer to implementing it.
All right. So is there a plan to test residents at residential care facilities for COVID-19? I know you talked about screening people who work in the facilities, but what about residents themselves?
Yeah, we've been actually doing surveillance and screening amongst residents also. So we've gone to, I think, at least half, if not more, of the skilled nursing facilities in Sonoma. And we've gone to a bunch of residential care facilities as well and tested both staff and residents.
So right now, community members are able to call and ask for a test should they want one, but this isn't really something available to people who are incarcerated or in a care facility. Are there any plans to be able to allow them to be able to call and request that someone come to them and do a test?
Well, we're already in the public health department going to these places. Like we've already tested in the jails. In the jail, like I think all of the staff and all the inmates that were there, and nobody was positive. We've gone to every homeless shelter and tested staff and residents, and many residential care facilities, and some have asked us to come and test there, and we've gone.
And so you said some have asked you to come and you've gone. Does that mean, can you explain a little bit about that process?
Well, you know, we like to go into representative facilities, so when we have a call with the facilities, we ask them who would like to have us come in and test for a representative sampling, and we've had several step up and say we'll volunteer. But we are trying to get through most of them at this point.
Have you had facilities that won't allow you in to do testing?
There have been a couple that have been reticent to have us come, but we're working with them to see if they would reconsider.
Is that concerns for safety? Have they given a reason?
Well, no, I actually am not entirely sure about that. I don't know what the reason is behind that.
All right. Well, is there anything else that you want residents to know about testing at this time before we move on to some other topics?
Yeah, I think the main thing is to understand that we're really scaling it up, and it's been really fantastic to have the state pitch in as well. We plan to reach our goal, which is about 700 to 800 tests in the next couple of weeks. I'm hoping that we'll be up and running. And then once we get this kind of testing in place, of course, it makes it much easier for us to loosen shelter-in-place restrictions along with the intensive contact tracing that I've been talking about.
Right. So are we much closer to the testing needs in order to begin looking at how to reduce restrictions? I mean,
yeah, we're actually, along with the governor's executive order, moving towards phase 2 of the roadmap, so to speak. So we're still in the preparedness, safety and preparedness phase 1, but we're moving towards allowing, lifting more restrictions on retail businesses, for example, for curbside pickup. That would be part of our initial phase 1 plans.
All right, so we're going to talk more about the phases and eventually loosening shelter-in-place restrictions in a minute. But first I want to go back to the modeling data that we talked a little bit about last week. So our original modeling showed that we would have a peak at the end of May, beginning of June. What does the new modeling show about a potential peak in Sonoma County?
Yeah, it would probably be much later in time, and it would still be, the peak would be lower as long as we really focus on finding our cases with contact tracing, intensive contact investigation. If we can identify people with COVID who are symptomatic within 4 days or so of when they become symptomatic, and if we can also identify asymptomatic persons in the community that are cases by doing our contact tracing, that we can really flatten the curve still, even with loosening shelter-in-place restrictions. So that's really something that we'll be talking more about.
All right, so we do have a number of questions from viewers who feel that in part they look at this modeling data and they see that it seems like we've really flattened the curve, it seems like good news, and they want to know why we're still sheltering in place. So I'll read a few specific questions for that. So the first one is, the number of COVID-19 cases and deaths seems low compared to the flu. Let's unpack the first part of that question first. Is it low compared to the flu?
Well, not if you take a look at the case fatality rate. In other words, the total number of people that are dying over the total number of cases, which is what we've been talking about, is a lot higher for COVID than the influenza.
So the second part of the question is, why is there a continued order for shelter in place, considering it seems like we're flattening the curve?
Well, that's, as you know, we've already revised the shelter in place order as of just yesterday, actually went into effect, where we're have already relaxed the construction to outdoor workers like landscapers and gardeners, arborists, pool maintenance staff. Those professions have already had restrictions lifted. And you know that we did have a very nice opening of our parks, and thank everybody for making that work out. So it's been a very good experience so far without overcrowding of parks. So I think we're already moving in the direction of loosening shelter in place.
All right, so let's talk a little bit more about what those plans will look like. The next question is, how does the county plan to lift shelter in place? How does the county's plan to lift shelter in place align and differ from the California Resilience Roadmap stages presented by Governor Newsom?
We're planning to align. And we've been hearing that the governor is going to actually have a new executive order out, probably on Thursday, moving us into the first part of phase 2, which really speaks towards retail businesses such as clothing sales or shoe sales, antiques, furniture, sports equipment, whatever retail business that can do curbside pickup and sales will be allowed to move forward, and I think that's going to be announced on Thursday.
And again, for those that don't know, the resilience roadmap stages are just the phases listed about when we can lift certain restrictions. And so on that same note, what about things like hotels, Airbnbs, and tourism?
Yeah, those are further into our phases. I believe those are closer to phase 3 in the governor's plan. So they're definitely on the list to move towards. All
right. Well, are there any ending notes that you wanted to give people before you leave for tonight?
Just that everybody is doing a great job with staying at home, and also with when they do go out to implement all the guidance that we've given in terms of facial coverings and the physical distancing. And I really thank people for doing that. Understand that there's a lot of frustration out there, but just, we're all on the same page and moving towards getting people out and about, and to allow our businesses to start being in business again.
Well, thank you so much again for joining us every week. We look forward to having you on next week as well.
Okay, well, thank you very much.
All right, so last week, Sonoma County began reopening regional parks. I spoke with Regional Parks Director Bert Whitaker on Monday about how residents took advantage of the new rules over the weekend. I also asked him some of your questions.
Interestingly enough, Saturday with the break in the weather, it was fairly light crowds. The places we expected to have a lot of folks getting out with a lot of surrounding neighborhoods were being well used. And the report from my ranger staff was that the overwhelming majority of folks were being highly respectful of one another, keeping a safe space, and really just appreciative of getting out.
Did you issue any citations over the weekend?
We did issue a few. They were parking citations. About 10 were issued, and about a little over 100 warnings across the park system.
So we do have a number of viewer questions about the park's closure that I'll jump into now. The first is, people are driving to neighborhoods and many cars are parked on our local streets to walk to local trails. Is this okay?
Technically, that is not okay. Folks should be, as I said, walking or biking to parks nearby their home. We certainly received a number of reports over the weekend of folks using their vehicle to drive nearby, and we would prefer not to do that for folks to stay nearby. We are still in an emergency, and really asking everyone to do the safest thing, which is stay nearby and continue to shelter in place.
Did you issue warnings to those folks over the weekend?
We did. We put some warnings on windshields of those individuals, and did our best just to contact them and let them know that they need to use parks nearby their home.
At what point will you be shifting to issuing citations for that?
Our hope is certainly is to educate, and that citations are the absolute last resort during this crisis. We're really just asking for everyone's cooperation, and as I said, we're working hard to figure out how we make the arrangements to partially reopen these parking lots so that visitors and our park members can come back and visit their favorite park, which may be just out of walking distance from their home.
Are the state parks, Annandale, Sugarloaf, and Jack London, open per your limitations?
They are. They're open under the same conditions the inland parks are, with the parking lots are closed and individuals can walk or bike in.
How do you work with the state about these rules regarding state parks?
The state park system as a whole, for the most part, has been in the soft closure mode across the entirety of the state. And with Sonoma County's unique closure, they fell in line and adhered to it. It's been an ongoing conversation. I speak with state park staff, local leadership, as well as Sacramento leadership 1 to 2 times a week. And we're coordinating what we're seeing out there and doing our best to be good partners and serve the public with their need to get outside.
And how do you feel you've been able to enforce the rules so far? Has it been challenging for your staff?
It's actually been relatively enjoyable for the staff. They've had good reports of people really being grateful and appreciative of getting back in the facilities. We've put staff basically position them at the park entrances to welcome individuals, to help keep an eye on things, to check in, make sure people are bringing facial coverings and see if they have any questions about using the park. So it's been a good experience thus far going into day 6.
And what about beaches? Did you see a number of people driving up to coastal beaches again?
Yeah, we continue to see traffic at the coastal beaches. I would say this weekend was not as bad as some of the prior weekends. We saw more adherence to it, but I would say my staff contacted around 50 or 60 individuals a day in the Bodega Bay area. We still continue to see, more than 50% of it is traffic from out of the county or even out of state. A number of visitors with out of state license plates we came into contact this weekend.
We have had a number of viewer questions from residents in Bodega Bay, specifically asking about beaches. I'll read one of them since they're all along the same lines. When can the residents of Bodega Bay use the beaches that are nearby? Without them, we have to travel to other neighborhoods to visit parks.
No, thank you. That's a great question, and we're getting a lot of that in our email inboxes as well. And the conversations are happening right now on how we ease the coastal restriction. It's obviously a large statewide issue with overcrowding and folks flocking to the beaches. And certainly we have small rural communities, and Bodega Bay is along our entirety of our coastline, and really want to be careful and ease the restriction from a full closure on the coast in a very methodical way that allows some ability to make sure that the overcrowding does not just immediately swallow up the community and cause other problems with public safety and people's ability to stay safe while getting some recreation, some time out at the beach.
We've also had a number of questions from surfers. So what about surfing? Is this allowed and why not?
Yeah, right now, all access to the parks, trails, and beaches would be closed, which would restrict surfing at the coast. And it's many things that we're looking at right now and discussing of how do we ease up and allow folks to get out there and have safe and enjoyable, healthy outdoor activities, of which surfing, being a surfer myself, I hear you, and want to get you back out there in the waves as soon as we possibly can once it's safe to do so.
And the concern we're also hearing is that surfing inherently involves social distancing, that you wouldn't be close to other surfers. Can you speak to the reasoning behind surfing not being allowed?
Yeah, I think that would not disagree that surfing in itself is social distancing. The problem we've seen and what we saw before the beaches were closed, it's those congregation points, it's the parking areas, it's individuals coming down and gathering in groups. And so those are the things that we are focused most on.
There's also a concern about equity. We've gotten a number of questions on this topic. I'll read one of them. Parks are open, but we can only bike to walk to them. Half the county is being alienated or punished for not living near a park. Why? Can you speak to the equity concerns about park access at this point?
I would love to, and we do not question this is a far from equitable approach to restoring some access to our parks. I can't emphasize enough that this is a temporary condition, and we were working hard to ease the restriction on the parking lots for that exact problem. We have many folks living around the county in apartment units or other areas that are not walking distance to a park. And please continue to get outside, get some fresh air, walk around your neighborhoods. And we are, like I said, very pleased with the first 4 or 5 days of this soft opening, and looking forward in the next few weeks to restoring that vehicle parking within the parks, because we see that there is a great part of our community that needs to get outdoors and benefit greatly from being back in the parks.
Workers on the front lines say that they're struggling to make ends meet in low-paying jobs that don't offer enough protections. Well, a group in Silicon Valley offered some of these workers a chance to be heard by lawmakers taking up their cause. South Bay reporter Pamela Lawrence has the story.
Santa Clara County is among the 6 Bay Area counties to loosen some restrictions under a renewed shelter-in-place order. Those able to work from home while sheltering in place have come to rely on essential workers to fulfill basic needs. These jobs are typically low wage and disproportionately held by women, particularly women of color. They're the folks delivering groceries, working in fast food restaurants, and providing health care. And they say their companies aren't doing enough to keep them safe. Essential workers were invited to share their experiences with Congressmember Ro Khanna and Santa Clara County Supervisor Cindy Chavez during a virtual panel discussion hosted by Silicon Valley Rising, a labor advocacy campaign from Working Partnerships USA.
Los trabajadores de comida rápida.
Fast food workers like me have been classified as essential workers during the pandemic, but McDonald's has been treating us as if we are all disposable and we're terrified. We're risking our lives to help feed our communities, but are being paid poverty wages and are not receiving the protections we need. Over the past 2 months, fast food workers across the country have had no choice but to go on strike to demand very basic protections like masks, gloves, sanitizer, and hand soap. At my store, we had to walk off the job 3 times before McDonald's finally met our demands and provided workers with adequate PPE. While winning PPE was an important victory that made our workplace safer, not all our demands have been met. Workers at my store and across the fast food industry still lack many important protections that we have been fighting for even before the pandemic. Paid sick days feel more important than ever, but companies like McDonald's make it so hard for us to take them.
That was Micaela Garza, a worker at McDonald's. I reached out to McDonald's for a response. In a written statement, they told me, McDonald's and McDonald's owners and operators remain committed to protecting restaurant employees, customers, and the community during this unprecedented time. We are disappointed to learn of this individual complaint, as it does not represent the actions we have taken in restaurants across the country as we continue to serve the healthcare heroes on the front lines. The representative told me they're acting in accordance with CDC guidance and in full compliance with all state-level orders, including sick pay and PPE requirements. Some restaurants have even taken additional steps by installing protective shields and implementing wellness checks. Representative Ro Khanna had the opportunity to address some of the workers' concerns. He and former presidential candidate Elizabeth Warren have proposed an Essential Workers Bill of Rights intended for the next federal coronavirus relief package. Among the policies specified are health and safety protections, robust premium compensation, protections for collective bargaining agreements, and universal paid sick leave.
We need to make sure that workers get the equipment they need to keep them safe, that you can't ask people to come into work and then not give them equipment or not follow the procedures to make sure you're not putting them in danger. We know by the definition that they're at higher risk. Anyone who goes and works at this time is taking some risk, and they're willing to do that. We need to keep them safe, and we need to pay them for what they're worth. Obviously, they're worth a lot if we think they're essential.
Other lawmakers are taking up that challenge as well. California State Senator Maria Elena Durazo introduced the Health and Safety for All Workers Act to address the needs of domestic workers. SB 1257 would afford basic labor protections, health and safety training, and protective equipment to this essential workforce, serving more than 2 million private households in California as house cleaners, nannies, and in-home attendants to seniors and people with disabilities. On May 1st, the day to celebrate international workers, a car caravan set off from Santa Rosa to Sacramento to bring workers' concerns to Governor Gavin Newsom. Socorro Diaz, a domestic worker in Sonoma County for 16 years and leader of the women's group Almas, which is part of Grayton Day Labor Center, was part of the caravan. Her message to the governor was, "We matter. It doesn't matter if we have a piece of paper or not. Our status doesn't matter. If we get sick, we need support. If we stop working, we need support. It's important to pass rent cancellation, pass SB 1257 to protect immigrants and day laborers.
Please share your questions with us so that we can get answers for you during these live town hall programs. Visit the easy-to-use contact form on our website at norcalpublicmedia.org/coronavirus. Fill in your question, share your name and your email, and select the subject of your question, and then click Submit. On the website, you'll also find a Frequently Asked Questions section where many questions have already been answered. Tonight's program is being translated in Spanish live right now on La Mejor Radio 104.1 FM. We thank La Mejor Radio for their partnership on these town hall programs and for the service they provide to our community. Well, up next, State Senators Bill Dodd and Mike McGuire join News Director Steve Mencher on Friday to give us a better understanding of how legislators have been working with the governor in Sacramento and to answer some viewer questions.
Here's one question that came in. It came in Spanish, and we'll translate it. It says, I am looking for financial help. I was laid off due to COVID-19 and now have not had any type of income for a month and a half. What do you say to folks? And let me also add on top of that, is the state doing a good enough job communicating with people whose main language is Spanish? And how would you answer this person's question?
Well, I've seen in Sonoma County and Napa County the bilingual translations of everything they sent out. I think they're working as hard as they can, but you know, it may never be enough, and we've just got to keep working, on that to do more and more and more. I would say, to me, if she is a citizen of the United States, she has been working, she should be getting unemployment. If she wasn't part of the original unemployment insurance, I think it was as of yesterday, she could have apply. She can call my office or email my office or Senator McGuire's, regardless of whose district she's in, and get help from us. And if she's not documented, there still is some help on the way that's coming. And I support the governor that's done that. A lot of these undocumented people that are in our county are working very, very hard with our companies, with our main industries, helping our economy grow, and they shouldn't be left behind.
Senator Dodd is 100% correct. Look, if an individual has been laid off due to the virus, they should be immediately applying for unemployment via the state of California. There will be two types of unemployment that the individual will be eligible for. Number one, they'll be eligible for state unemployment. State unemployment will last for 6 months. And then for the first 4 months of those 6, individuals will also qualify for the federal unemployment benefits that are being distributed through the state. The way the federal unemployment benefits work, if you apply for state and you are eligible for those federal benefits, you will see a maximum of $600 per week. That's a flat fee for the first 4 months of your 6. Now, if the individual is undocumented, and if she is undocumented, a special fund has been created by the state of California, $125 million fund, the first in the nation, I might add. And it's $75 million in state dollars, additional $50 million that's being raised from sponsors and donors from across the West. And individuals can apply for $500 one time or a family up to $1,000. And I think we need to be able to state this. Here in California, we believe that diversity is who we are and what makes our economy strong and our communities thrive. No matter if you are a documented resident or not, you should be eligible for these benefits. I think it's an important statistic to note. The vast majority of those individuals who are undocumented are taxpayers, and they should be eligible for those same benefits as those who were born in this nation. This has been a priority for the state Senate, for Senator Dodd, for myself, and it is just egregious that this president here in the nation has made immigrants scapegoats, those who are undocumented scapegoats. Now is not the time to divide. We have to come together as a nation, no matter your documented status.
Finally, I wanted to give each of you the opportunity in a kind of a lightning round. The progressive groups right now are saying this is an opportunity that shouldn't be wasted. We really absolutely need to make sure that the least able economically in our society can move forward and not go back to anything that was sort of normal before. And so I was looking at one list of demands today where a student group who go to Cal State said they were going to be out in the streets digitally or virtually demanding things like rent, mortgage, utility freeze, universal housing guarantees, clemency if possible, and release of incarcerated people if necessary for their own health, cancellation of student debt, wealth tax. These are some of the things that obviously were some of the issues in the Democratic primary. And yet, tell me, each of you, what you're thinking about what we can move forward with, what we can do in a progressive manner to make sure that everyone in our society recovers at an equal rate. Mike, perhaps you might start.
Sure. I think I'm going to, if it's all right with you, Steve, just talk about a few subjects in where I think that we can make some progress. Number one, so with this virus has shown us that we have significant inequities in our society. And by the way, the gap in wealth in this state and this nation has never been greater. And I am a firm believer that this virus is going to make that challenge even larger. So first and foremost, we need to be able to focus on affordable housing for Californians in this state. You're going to see the state Senate advance a robust, aggressive housing production package of legislation here in the coming weeks. We have to make sure that we are focusing especially on low and very low affordable housing, especially on rentals. We are shy 1.5 million affordable housing units in this state between 2015 and 2025. That gap is going to grow more significantly due to the coronavirus. Number two, healthcare. We have to continue to march towards a single payer system in this state. The governor has established with legislative representation a group that is focusing on the finances related to a single payer system in this state. That work is going to be more important than ever. Three, undocumented. Thanks to the leadership of so many in the Senate, we have expanded Medi-Cal benefits to those under the age of 30. One of the proposals was to be able to expand Medi-Cal benefits to those over the age of 65. Senator Dodd will be able to speak to that. I think that is critical. And finally, we have to be able to focus on homelessness. We can't lose sight on it. It is a crisis in the state. We are the wealthiest state by far, the fifth largest economy in the world, and we have to tackle this homelessness crisis. You're going to see intense focus by the Senate on homelessness in the weeks and months to come. But Senator Dodd, I know many of these are also priorities of yours.
Yeah, absolutely. I think it's really important that everybody realize. I think it's not only at the low end. We have lost our middle class in many respects. And I think it's really critically important to focus on not only affordable housing, but more market rate housing, because that creates affordable housing as time goes on. The other things with this pandemic is it is going to hit the middle class hard too. A lot of these business owners will no longer have businesses in 2 to 4 weeks, or when they're going to try to come out of it. It's a really big concern for our economy. So while it really is important for us to focus on things like healthcare, all these initiatives that we have had before this pandemic are going to be more challenging over the next 2 years. So while people are rallying to try to get more done sooner, I just want to caution them. We are going to have less money to do the type of things that we were already planning on doing before.
More than 30 million Americans have filed for unemployment since mid-March. Many of them are struggling to pay rent and keep up with other bills. Next up, we have Ronit Rubinoff, Executive Director of Legal Aid of Sonoma County. She'll be talking about tenants' rights and other legal issues that have arisen during the pandemic. Thank you so much for joining us, Ronit.
Thanks for the invitation.
So let's start with some tenants' rights issues. What have you been hearing in your office? What kind of help are people looking for at this time?
Well, I think overall everybody is panicked whose income has been affected by COVID, which is a large number of renters. Proportionately, the largest sectors of folks that are missing income right now are renters. And so those folks are, of course, everybody knows, panicking about how they're going to pay the rent and what's going to happen when any protections currently in place are lifted. So we're trying to inform people about what the status is right now, and there's still a lot of confusion. There's been a lot of different laws out there from the state, from the county, and even the city, and so people are kind of confused about what their rights are. Just want to let people make clear that right now the biggest source of protection for tenants is a rule that was passed by a state body called the Judicial Council, and that rule says that the courts cannot issue any evictions until 90 days after the state of emergency is lifted. So let's say the governor lifts the state of emergency on June 1st. 3 months after that would be the first time that a tenant could receive an eviction complaint. Now, that covers all types of evictions. It doesn't have to do with COVID specifically related payment, rent payment issues, or the reason for the eviction is immaterial. Any kind of eviction would be suspended until that time period. So that's really, really important for people to know. The courts are going to be open probably beginning of June. Currently, our local court is posted that they're going to be open June 1st. So there may be filings made in eviction cases. You, as a tenant, may receive a notice of termination of tenancy from your landlord. But again, that eviction complaint process can't go forward until at least 90 days after the state of emergency is lifted. So
what should you do if you get an eviction notice?
Well, again, a notice would be probably a termination of tenancy notice. A couple of different things. First of all, let's talk about non-payment of rent. That's the biggest issue people are having. There are other issues out there, but let's focus on that for a minute. Non-payment of rent. You still have an obligation to pay rent. Right now under the law doesn't say you don't get to pay rent. The law simply says you're not going to be evicted at the moment, right? So you're still under obligation to pay the rent. You should try to do so if you can. If you can't, you should have dialogue with your landlord. You should explain to your landlord what's going on. You should always document the reasons why you can't pay your rent. That's the number one source of advice. The other thing you can do is call Legal Aid's housing hotline and talk to us, and we'll give you some more information about your case in particular. Let me say something that we're looking to have passed, though, going forward. What we and other advocates around the state are trying to push for at a minimum, is a law that after that 90 days lapses says you cannot be evicted for non-payment of rent that accrued during this COVID emergency. That is not yet law. That is something we are seeking because we recognize that a tenant, especially in an economy like ours where the housing costs are so great, even if they get their job back, they're not going to be able to catch up with months of arrearage, and certainly not in a short period of time. So the request that we're making to local governments and state governments is to say that rent should be converted into a consumer debt. The landlord can still collect it, but can't evict you. So just if you hear anything about that, that's what we're pushing for.
Right, I know a lot of people are really worried about that right now.
It's going to be a problem. It's just forestalling it. 90 days is not enough for people to recover. So we're going to be in a world of hurt with what we call a tsunami of evictions across the state of California if we don't get protections in place.
All right, so let's talk about some other legal help that people might need at this time. We've also seen domestic violence calls rise nationally,
Right.
and courts are closed during this time.
Right.
So can you talk a little bit about what people can do to get legal aid?
Yeah, so we're super concerned about incidents of violence that are occurring between elders, domestic violence, child abuse. These are all on the rise around the world. And the big concern, of course, is people are trapped with their abusers frequently, and they can't get out of the house to find a safe place to even make a phone call. So we're very vigilant about that. But I do want people to know that even if they're in a situation where their home is not safe, if they can just get away long enough to make a phone call to us, we can get them that protective order and get that abuser removed from the house. They don't even have to leave the house themselves as a victim. We can make it all happen electronically. They don't have to go to court. The sheriff will serve it, the restraining order request for them, and they do not have to leave their house to do so. They don't see us. They don't go to court, nothing. So I think it's really important that victims know that there is protection out there for them. The other thing I want to note is if someone has an existing restraining order, that restraining order date, if it comes up during the court closure before June 1st, it is going to be kicked out. That restraining order will remain in effect, and that victim will receive a notice by mail that tells them when their new court date is. Again, if you have any questions about this, please call Legal Aid. We have a domestic violence hotline number. You can call that and get more information about your case in particular. And again, we can help you request an order if you don't have one already.
And we did put that hotline number on our screen. We also
Great.
have it on our website, which is norcalpublicmedia.org.
Great, thank you.
You can find all that information. So we did get a number of viewer questions as well, who have some help. Questions that they're asking about help that they can get. So the first question is, I am currently homeless and have been for about 3 years now. I have congestive heart failure and have been waiting for Social Security benefits. What options are available to me to protect myself during this time?
Yeah, first of all, I'm so sorry for that individual. I mean, it's just a terrible time to be in that kind of predicament. A couple of quick suggestions. First of all, one can have that Social Security application expedited, and Legal Aid can help the individual do that. So if they want to contact our office, call our elder hotline, we can assist them in trying to expedite that. Secondly, if they're not already receiving general assistance, they may be eligible for that. So again, we can help them with that process. Then there are lots of social service agencies out there, many that I don't even have time to list, that are assisting folks with meals and shelter and all that sort of thing. That's not our bailiwick, but there's a myriad of agencies doing that.
Can you help connect people with those services?
Absolutely, absolutely.
Okay,
yeah.
So if they call your hotline again, you can help connect them?
Absolutely.
So the next question, I have heard that the $1,200 in stimulus money that some of us have received will be deducted from our tax refund next year. Is that true?
No, normally the government giveth and taketh away, but not in this case. So this is not taxable income, and it will not impact any refund that you are due and owing next year. It is neither of those. It is just a check.
Good to know. So let's see, we might only have time for one more question, but can employers compel people back to work? If I feel unsafe, will I lose my job or any sort of benefits?
So this is a very complex question, something I certainly can't answer in this amount of time. I suggest they call our disaster line and we can walk them through in their individual case. This is a matter of degree. What kind of safety issues are we talking about? It's also a matter of how the individual is situated. So in other words, if they come with a pre-existing condition that makes them particularly vulnerable to COVID, perhaps there's a reasonable accommodation that they're due and owing that would allow them to do some work from home, as an example. Last question is really great.
All right, one more question.
Yeah.
So this person is 80, they live alone, they rely on their son for help. Do they have any other ways that they can get help?
Yes, if you're a senior and you're afraid of having contact with family members because of their exposure, you may be eligible for IHSS home support. And again, call our elder line. We can walk you through that and see if you're eligible, help you figure that out. That will bring somebody into your home as a caregiver on a part-time basis to do all those basic functions probably that relative is doing for you. So yes, there are options for folks, and there's some programs out there that are also providing some of those services for seniors because we recognize that elders are isolated right now.
Well, thank you so much again, Ronit. We really appreciate you coming on the show. Board of Supervisors Chair Susan Gorin spoke with News Director Steve Mincher yesterday, and the focus was on how increased testing could lead to the kind of business reopening that everyone is hoping for soon.
The county is talking about how we reopen even more businesses and a protocol that might be established by employers to check the health and certainly the temperature for those returning employees. We're looking at encouraging employers to purchase some of the touchless thermometers so that they could take the temperature of those employees that may be coming back into the office or businesses. And we'll be having a conversation about the app that you can download on your cell phones for both employers and employees to really think quickly about how to take your temperature and how to access your physical health before you return to work. But I think the real answer to the question is, how do we ramp up the testing for many other classes of employees so that employers and employees feel safe going back to work? Many essential businesses, water treatment plant operators, transit operators, staff in skilled nursing facilities are all considered essential employees in my book. And we want to make sure that they're safe going back to work. But that's where we've been going for the past couple of weeks and past month, is trying to get enough testing equipment so that we can increase the testing. We're so grateful to the state for volunteering additional testing sites. So if you are a member of a community, you can contact that number for an appointment. And we now have new testing sites that will be set up at Santa Rosa High School and a facility at the Santa Rosa Junior College at the Petaluma campus. So call that number, get an appointment, and you can sign up for the test.
Coming up next, Steve Mencher spoke with Sonoma County Supervisors David Rabbitt and Lynda Hopkins yesterday. On Sunday, Hopkins organized a Facebook Live event focusing on reopening the county safely. You can find that event shared on the NorCal Public Media Facebook page. Supervisor Rabbitt talks about the great response the event received.
Well, I think anytime there's a disaster such as we're experiencing, people just want information. They just want to know what is happening. Are we working towards reopening? What criteria need to be met in order to get there? And so I think it was really important to be able to provide that information and also give a little background regarding the relationship to the county order, to the state order, for instance. You know, we've been struggling with where the state was in terms of businesses that were essential or non-essential, and there was no in between. And those were really definitions that came out of Washington, D.C. and don't necessarily always have everything to do with health risk. So it's been something that's been frustrating, I think, for both Supervisor Hopkins and myself and the entire board really, is that we'd really rather have a risk-based approach where we can look at activities related to the associated health risk and then mitigate them to the best degree possible going forward. But I feel good about where we're at as a county.
All right, Lynda, and here's another question that came in to us that I might ask if you can answer. The county parks are now open, but only if you can bike or walk to them. And this person asks, they say half the county is being punished for not living near a park or perhaps living in a rural area. So how is this fair?
So I want to be very honest. This is not fair. We are not living in a world where we can really make decisions that only focus on fairness. And it's an extremely frustrating place to be in for those of us who are in leadership positions. And I know that this is something that weighs very heavily on our public health officer, Dr. Mase, and our director of regional parks, Bert Whitaker, who are really instrumental in the decisions surrounding the parks orders that have come out. And right now we're in a situation where this is creating inequity. I represent a lot of constituents who cannot safely walk or bike to a park. I represent a lot of constituents who live in Southwest Santa Rosa, which has some of the lowest kind of parks per capita ratios of anywhere in Sonoma County. And unfortunately, we are in a place where we are having to make least worst decisions rather than best decisions. And this was one of those instances. I do know, though, that we are hard at work trying to come up with mitigation measures that will allow people to actually drive to parks. I recognize the burden that the sort of walking and biking rule places on some of the seniors in our community. Also people like myself who have young children that can't walk very far. Also people like myself who live in rural areas where we don't have sidewalks. So actually to walk or bike would be a very risky sort of place to take your young children. So it is not a fair rule or a fair order, and I want to acknowledge that and note that we are working to make something better. But I think it's also important to remember that the reason this unfair rule is in place is to protect the public health, and that what we want to do is gradually loosen restrictions over time. If we open up Pandora's box and we change a bunch of things all at once, and we see a spike in cases, then we have to put everything back into the box. Whereas if we over time kind of gradually loosen in thoughtful ways that still protect the public health, that's how we can make sure that we're keeping a grip on COVID-19 in Sonoma County and we're not seeing runaway case and community transmission.
All right, finally, I would like to ask both of you, as you're planning for the future, what you're hearing from economists and from others about the resources that will be available to the county, and if we are having to live with far fewer resources, how we're going to recover going forward from this pandemic. Perhaps I'll ask you to start, Lynda.
You know, I think that we are at a pivotal moment in history. We are living through an unprecedented global phenomenon. The last time that, the world experienced a pandemic of this magnitude, we didn't have planes. Most people didn't have cars. A virus now has the potential to spread much more rapidly than it ever did in the past when we face down something like this. And so, in as much as we have this kind of global catastrophe that we don't quite know how far down the trough will go in terms of the economy, because we don't know exactly what's going to happen when we start pulling these levers, when we start loosening these restrictions. How far can we go to restart our economy before we reach that tipping point and we start to see exponential rise in our local cases again? But so as dire as it may feel to read some of those news reports, to read some of those analyses regarding the skyrocketing unemployment rates, I also actually have a lot of hope. And I have a lot of hope because I continue to see the creative, kind spirit of Sonoma County residents time and time again. The distilleries down in Supervisor Rabbitt's district, they're repurposing themselves to produce hand sanitizer. The neighbors who are just checking in and dropping off food or homemade masks on the porches of their friends and family members. People going just to sort of, wave through the window, even if they can't touch one another, and give each other hugs on a birthday. And so I really do believe we're going to get through this together. And I do believe that we're going to bounce back.
Supervisor Rabbitt, I'll give you the last word.
I think what's true is the foundation of our economy was strong. We went into this not because of the stereotypical economic indicators we're going to predict a recession, but because we purposely stopped the economy. So it's different than, I say, 2008 or in 89 when there were recessions in the past. So it'll be interesting as we come out. I do think that duration and depth really matter, how long this will go on and how quick we can get people back. It'll definitely be a financial hit, and I'm not underestimating what's happened to really a minority of folks that were caught in those businesses that weren't allowed to go forward, that lost revenue, that lost paychecks. But again, I would say the foundation of our economy was strong, and that hasn't necessarily changed yet. Again, if we can get through this period of time and get ourselves across and adapt our business models going forward, we can escape severe damage. I still think it's going to take a while to catch up, but I think it's just different than a stereotypical recession in that, again, the indicators weren't the same. But it's really about how quickly can we move forward, open up as many businesses, get paychecks to people as quickly as possible. We're still going to have to take all the precautions to combat the virus going forward. But I hope that our economy, while we'll take a hit, can be lessened somewhat because of those circumstances.
All right, Supervisor David Rabbitt, Supervisor Lynda Hopkins, thank you so much for joining me.
Thanks, Steve.
Thanks for taking the time.
Thanks for joining us for Coronavirus, What You Need to Know. Keep tuned in to NorCal Public Media. I'm Darren Lachelle for NorCal Public Media with Adia White. Good night.